Assalamu alaikum. Let's start the first disease of the lung. It's the atelectasis. What's the atelectasis? What is the meaning of atelectasis? Atelectasis means it's the collapse of lung. It's the collapse of lung. We divide this atelectasis into type 1. Here we having the type 2 and this one is type 3. The three basic type of atelectasis, and this is the first type. Okay, first we talk about the first type here, contraction collapse. What's a contraction collapse? This type of collapse mostly is seen in the patient having interstitial lung diseases. The interstitial lung diseases, these diseases lead to fibrosis. Interstitial lung disorders lead to fibrosis. So what happened in the fibrosis? In the fibrosis, a more deposition of elastin. When we deposit too much elastin, elastic have contractile property. So before we going to understand the why collapse in the interstitial lung disorder, first we think about a little physiology here. That there are the four forces here. The two forces, they try to collapse the alveoli, and the two forces, they don't let the alveoli to be collapsed. Okay, so the preventing forces and collapsing forces. The collapsing force here, number one, the elasticity present in the wall of the alveoli and the surface tension due to water. Presence of the water, moist surface of the alveoli, the surface tension and elasticity, these two forces here, these two forces try to collapse. And the second, and these two forces not allow these two forces against these two forces, and the preventing, so these two forces are preventing forces from the collapse. The surfactant, it can cancel the effect of this surfactant can cancel this surfactant can cancel this force, and this alveolar air, this air is working against elasticity. So now what happened in this case, contraction collapse? The contraction collapse mostly seen in patients with interstitial lung disorders. In interstitial lung disorder, what happened inside the lung is a fibrosis there. So when the fibrosis there, the more deposition of elastin, the elastin deposit in the wall of alveoli. What happened with the elasticity? So this force increased too much. If this force increased too much, it can overcome the alveolar air, and even surfactant is not able to help keep this alveoli open. So this happened in the interstitial lung disorder. The interstitial lung disorder increase in elasticity, so it lead to collapse of the lung. This is the main criteria, the main concept behind this. And the next thing here, we can see the second type of collapse is compression collapse. What happened inside the compression collapse? It is a pleural cavity here. This is a pleural cavity. The pleural cavity here, you can see that the pleural cavity is filled with water here. The pleural cavity, when having too much water, and this pleural cavity is a compression of this pleural cavity may have water here. This pleural cavity may have air here. If have water here, and this condition known as hydrothorax. The condition known as hydrothorax. If the pleural cavity having too much air, this condition known as pneumothorax. So the two conditions are one hydrothorax and one pneumothorax. In hydrothorax, what happened? Oh, now we can see here the hydrothorax is a pleural effusion case. Hydrothorax is also known as pleural effusion, the excessive accumulation of water inside the pleural cavity. So now these two forces, now here water or air can press the lungs easily, clear? What's the main difference? Let's explain the what happened to the trachea, where trachea moving to the affected lung or toward the normal lung. What's the main difference between all these three collapse? First, we try to understand why this collapse are happening. Okay, this collapse due to excessive water and the air inside the pleural cavity. So pleural cavity, normally we having negative pressure. Which pressure? Negative pressure. But when this pressure become positive, in the physiology, we're done with the physiology that the pleural cavity normally having suction pressure, and it help the lung expansion due to this negative pressure help for expansion of lung. But when this what happened in expiration case, when we expire air, pleural cavity pressure increases, and this pressure press the lung, alveoli pressed, and the alveolar pressure increases in the atmosphere, then air is coming out. And if the positive pressure now is a pathology here, that we're already having a lot of water in the pleural cavity and a lot of air inside the pleural cavity. Now this water and air increase the pressure inside the pleural cavity, and the pleural cavity, pleural cavity pressure become positive, and is too high and also too high. This pressure now doing what? It can compress the lung. That's why it's known as compression category collapse. Now move on this category. The third type is known as the resorption collapse. Third type known as resorption collapse. If the patient having obstruction issue, maybe obstruction present here. Now you can see here this obstruction, the upper bronchus is blocked, and what happened with this lobe? This lobe is collapsed. Why is collapsed? Now again go back to these four forces. We have one force, elasticity; second force, surface tension; third force, surfactant; fourth one, alveolar air. Alveolar air. So four forces, and these two forces, one thing is surfactant, and second one is alveolar air. So these two forces try to prevent the collapse, and these two forces they always work against these two forces, and they try to collapse alveoli. These two forces work against them, and then they not allow them to collapse the alveoli. So now what happened here in the obstruction case? In the obstruction case, the alveolar air pressure is decreasing because why this happened here? Because now no more air is coming from outside. If no more air is coming from outside, the inside the alveoli, this pressure decreases. So if this pressure decreases, so what happened? This elasticity work against this pressure, and surface tension work against the surfactant. So if you decrease this force, now one preventing force decreases. So if one preventing force decreases, this is the alveoli. In the wall of alveoli, we having elasticity. So that elasticity try to collapse it. This happen inside the obstruction category. The air here, the no more air already resorbed inside the blood, and no more pressure here. If no more alveolar pressure, now this force, one preventing force is decreases. Okay, we're already having two forces to now one. If this force, no more this force, why? Because obstruction there. Okay, now question here, why this obstruction happened? If the child come with lung collapse, and child having the issue like foreign body, they inhale coin, they eat coin like this. There's some solid object, they enter to mostly coin. Okay, mostly coin, the foreign body. In case of adult, if the adult case they're having lung collapse, what happened inside the adult? Why lung collapse? The one cancer there, that cancer is the squamous cell carcinoma. This squamous cell carcinoma present in smoker. This squamous cell carcinoma is also known as bronchogenic carcinoma. It's also known as bronchogenic carcinoma. This bronchogenic carcinoma arises inside the bronchus here or here. This bronchogenic carcinoma is present inside the bronchus. When this tumor become much bigger, and it can collapse the for example, if tumor here, and this full lobe, lower lobe of this lung can be collapsed. So now there's two cases here. In the children, the mostly foreign body issue, and in adult, this may be lung cancer. Which lung cancer here? So squamous cell carcinoma. The squamous cell carcinoma is also known as bronchogenic carcinoma. It's a squamous category carcinoma. Okay, and the smoker is present in smoker, and this obstruction lead to collapse. These are three main category of collapse. Okay, now we see what the main differences between these collapse. or the main issue here. Now, if the contraction here, if in this case, if the contraction here, it can pull the trachea toward affected side. This side lung will be normal. This side lung will be normal, and trachea can deviate. This lung is affected lung. This lung is affected lung because contraction here. So when contraction here, this trachea can be deviated from the mid. This is a midline. Trachea present in the midline. Okay, we can see on X-ray the trachea present in the midline. This trachea can deviate it to the affected lungs. Trachea can deviate it to affected lung. I try to erase all these things, then we can make it more clear. Now, okay, now see, if this lung collapse, now what happened with this trachea? This is the trachea. Now this trachea can deviate it because the pulling here, pulling done by this lung. This lung undergo contraction. When undergo contraction, what happened with this lung? Undergo contraction due to I already explained interstitial lung disorders. Okay, due to excessive fibrosis there. So this trachea can move toward affected side. Toward affected side. This side lung will be normal. Trachea not moving this way. Trachea moving toward diseased lung. Okay. So from the movement of trachea, we can a bit guess. We can make an idea of which type of collapse there. Yeah. So okay. And next thing, now you see here the compression category. Compression category, we have water here, we have air here, and putting pressure on the lung. Now when you're putting pressure on the lung, what happens now is push the lung here upward. Now when push the lung, this is trachea in center. This trachea can also push. This is a normal side of lung. This is a normal lung. The trachea can deviate to normal lung. In this case, trachea moving toward normal lung. And next, what happened in resorption collapse? So in these two collapse, we can see the deviation of trachea, and here deviation is not much significant. Deviation is not much in the obstruction category. So we must able to differentiate these two collapse and what happened with the trachea. You must know the tracheal shift. Must know the tracheal shift. And this collapse, if the chances for trachea deviate, because this lobe collapse, trachea can deviate. This resorption collapse, trachea can deviate toward the affected lungs. In this case, it's a diseased lung, it's a normal lung. Trachea move to diseased lung. Okay, it's a contraction collapse. And now here the trachea move toward normal lung. It's a compression collapse. So compression collapse due to pleural effusion, and compression collapse due to pneumothorax. This is all about the story of the collapse. We can see in the next presentation here. Now everything is clear here. Resorption collapse. Resorption collapse already explained due to obstruction. The air is not moving. What happened? Alveolar air pressure decrease. Now elasticity become dominant and lead to collapse. So this is obstruction here. Foreign body, sometimes aspiration there. In adult, I already explained their lung cancer. Which cancer? Squamous cell cancer. In compression collapse due to air in pleural cavity, due to water in pleural cavity. Okay. And the contraction collapse due to fibrosis of lungs. Fibrosis of lungs, or deposition of elastin, or too much deposition of elastin, it lead to what happened? Elasticity increases. So elastic force increase, it become dominant and lead to collapse. It's all about atelectasis. It's atelectasis of lungs, so collapse of lung, 3 different types of the collapse.